FIP stands for feline infectious peritonitis, an inflammation of the membrane lining the abdominal wall and organs, except kidneys and adrenal glands. It is caused by a mutation of the feline coronavirus, which usually lives in the cat's gastrointestinal system and causes only mild diarrhea, sneezing, or coughing, with recovery in about a week. However, in about 10% of cases, the virus mutates, gaining the ability to infect white blood cells like macrophages, and since these travel throughout the body, the mutated virus, now FIP, spreads systemically. There are two forms of FIP, wet and dry, and they can sometimes switch between each other. Both forms may cause chronic diarrhea, weight loss, fever, and loss of appetite. The wet form, which is about 75% of cases, progresses rapidly, leading to swollen belly from abdominal fluid buildup, breathing difficulty due to chest fluid, and jaundice. The dry form develops more slowly and causes neurological or eye symptoms, including ataxia, which is unsteady movements, seizures, changes in eye color or pupil size. About 70% of cats with FIP are kittens under 1.5 years old, and half are under 7 months. This is likely because the infected mothers pass the coronavirus to their kittens between 5 and 8 weeks of age through close contact. Also, FIP has a 90% fatality rate without treatment, and treatment involves either a really painful stinging injection for 84 days, once a day, or a less effective oral tablet. The disease was first documented in 1963, so research only spanned about 6 decades. Once diagnosed, cats are given typically 2 weeks to 2 months to live, making the prognosis extremely poor. The good news is that there is a vaccine. The vaccine stimulates the cat's immune system to recognize the virus upon entry of the mucosal barriers. It is a modified live, temperature-sensitive mutant of the feline coronavirus that is administered intranasally. The local mucosa produces IgAs, so if the cat was exposed again to the mutant feline coronavirus, the immune system could prevent it from spreading to the intestines.
In the 60-year span, Figure 1 demonstrates 60 cats were affected. The sample distribution of the population was from 0.35% within mixed breeds to 1.3% in purebred cats. Representing purebred cats were highly affected as Abyssinian, Bengal, Burman, Himalayan, Ragdoll, and Rex. While sex didn't show a significant result, male cats were slightly higher than females, and the highest way to be infectious was reproductive and the possibility of gene mutation. In most cases, it was transmitted through bodily fluids, feces, saliva, and respiratory secretions.
Hi, my name is Andrea Rio. Today I'll be discussing FIP vaccines for cats, including their safety, side effects, and effectiveness. FIP vaccination can cause mild side effects such as sneezing or slight fatigue, while FIP itself can cause severe, often fatal illness with organ failure and fluid buildup. Vaccines are available through veterinary clinics and are only recommended for unexposed cats in multi-cat households, not for single or 2-cat homes, since most cats have a very low risk and the vaccine only protects unexposed cats. The older vaccine follows these guidelines, while the new Zoetis Vanguard intranasal vaccine for cats 16 weeks and older is temperature sensitive, stays in the upper respiratory tract, and helps prevent FIP. Vaccine effectiveness varies by strain, generally offering better protection against type 2 FIPV than type 1.
Hey, I'm Shashank, and I'll be talking about a few myths and facts about feline infectious peritonitis or FIP. A common myth is that the FIP vaccine completely prevents the disease, but it actually offers limited protection and mainly against certain strains. Another myth is that only outdoor cats can get FIP, when in fact any cat can develop it if they carry the feline coronavirus that mutates into FIP. Some people think vaccinated cats don't need other care, but keeping a clean, low stress environment and regular vet visits are still very important. And while feline coronavirus is common, the mutation that turns it into FIP is rare. In conclusion, FIP is serious but manageable. Vaccination, good hygiene, and early detection together gives cats the best protection. And here are our resources.